Welcome to the deep dive. Today, we're zooming in on, well, a hidden threat to one of the world's most majestic creatures, the horse. Imagine that powerful symbol of freedom and strength brought down by a tiny, almost invisible enemy.
It's a stark image, definitely.
And it's exactly what we're going to unpack today. Our mission is to really dig into African horse sickness. We want to pull out the most important nuggets of knowledge from our sources, giving you a shortcut to being well-informed. We'll cover, everything from how it surprisingly spreads to the really traumatic ways it can show up in horses, and crucially, what's being done to fight it. I'm genuinely curious to explore this disease because, well, despite the name African horse sickness, it really shows how interconnected global animal health actually is.
Exactly, and that interconnectedness is absolutely key here. We'll delve into why AHS matters, not just if you own a horse, but really in the bigger picture of global biosecurity. It's about understanding the mechanisms, how these diseases work and move, not just listing symptoms.
Okay, so let's unpack this. AHS. It sounds intense. What exactly are we dealing with here? Like, what is it fundamentally?
Fundamentally, AHS is a highly infectious disease. It targets the cardiovascular and respiratory systems of equids, so that's your horses, donkeys, mules, and zebras. The main signs are fever and quite severe swelling, which we call edema, and it's caused by a virus, the African horse sickness virus, or AHSV.
A virus, okay.
Yeah, and specifically, it's an orbovirus. That's a family of viruses often spread by insects. This one, AHSV, is what we call viscerotropic.
Viscerotropic, meaning?
It specifically targets internal organs, primarily the heart and lungs in horses. That's why it can be so devastating. And it's not just one virus. There are actually 9 known versions or serotypes. We label them AHSV1 right through to AHSV9.
9 versions. Wow. Okay, so it's a virus, hits the organs, spread by insects maybe. You mentioned that family. How does it actually move around? Is it like horse flu? Can they just pass it to each other directly?
Right, that's a really critical point, though. It's nothing like horse flu in terms of how it spreads. AHS is what we call an arthropod-borne disease.
Arthropod-borne, so insects.
Exactly. It's mainly transmitted by biting insects. Specifically, tiny little things called Culicoides midges. You might know them as no-see-ums or maybe gnats. They bite an infected animal, pick up the virus, and then pass it on when they bite another susceptible animal.
So it needs the insect middleman, basically.
Precisely. It is not directly contagious from horse to horse just through contact or being near each other. That's crucial. Now, while these midges are the main culprits, other biting insects like mosquitoes and maybe some biting flies could potentially play a small role too.
Okay, that makes sense. But here's where it gets really interesting for me. If it's called African horse sickness, does that mean it's stuck in Africa? Because you mentioned global biosecurity earlier.
Yeah, that's a great question. And the name is a bit misleading. It is endemic, meaning it's naturally always present, in tropical and subtropical parts of sub-Saharan Africa. But, and this is a big but, it has a history of jumping continents. We've seen significant outbreaks in the past in places like India, Turkey, the Middle East, Iraq, Syria, Lebanon, Jordan, even into Europe, in Spain.
Spain, wow.
Yes. And more recently, quite concerningly, there have been outbreaks investigated again in southern Africa, South Africa, Zimbabwe, Mozambique, but also, notably, way over in Southeast Asia. Thailand and Malaysia saw outbreaks in 2020.
2020, Thailand and Malaysia. Okay, that's far from Africa.
It is. The good news, for listeners in the U.S. at least, is that it is not reported in the USA.
Okay, that's reassuring. But how does it make those huge jumps?
It's often through the movement of infected horses, sometimes before they even show signs. But another way, which is quite surprising, is that the infected midges themselves can sometimes be transported long distances, maybe in aircraft cargo holds, or even carried by strong weather systems, like heavy winds.
Tiny midges catching a flight or getting blown across continents, that's kind of terrifying, actually.
It highlights the challenge, doesn't it?
It really does. So if this virus does manage to pop up in a new area, who's actually at risk? Is it just horses?
Well, the susceptibility varies quite a lot between different equid species. This is another really key piece of the puzzle. Horses are, by far, the most susceptible. Mortality rates are tragically high, often over 70%, and in the worst forms, it can hit 90, even 95%.
95%? Goodness.
Yeah. Mules are a bit less susceptible, maybe around 50% mortality. Now, here's where it gets interesting from a disease control perspective. African donkeys, they're generally quite resistant to actually getting sick.
Right.
They might show mild signs or none at all.
But they can still get infected.
Yes, they can get infected, and importantly, they can act as reservoirs for the virus.
Reservoirs, meaning they carry it.
Exactly. They carry it without necessarily showing signs, allowing the midges to pick it up from them. And zebras are even more resistant to the disease. They rarely show any clinical signs at all. Zebras are considered the natural reservoirs. They can harbor the virus for long periods, potentially spreading it via midges without anyone realizing they're infected.
Yeah.
That makes them, potentially quite dangerous in terms of disease spread.
So it's not just the obviously sick horses we need to worry about. It's these silent carriers like zebras and maybe some donkeys. That completely changes how you'd approach controlling it, right?
Precisely. You can't just look for sick animals to find the source of the infection. This hidden reservoir aspect is absolutely critical for understanding AHS and why it's so hard to eradicate sometimes.
It really shows how complex disease ecology can be.
It does. And it's not just equids either. We've found that dogs can get infected too. Usually it's from eating uncooked meat from an infected horse.
Dogs, seriously.
Yes. And there's some growing evidence suggesting dogs might also get infected directly from midge bites in some cases. And when they do get sick, it can be severe, often fatal for the dog.
Huh. I wouldn't have expected dogs to be involved.
It adds another layer. And just to note, within horses, there doesn't seem to be any particular breed, age, or sex that's more likely to get it than another. Oh, and the incubation period, the time between getting bitten by an infected midge and showing signs, is typically somewhere between 2 and 14 days. Usually averages around 5 to 7 days.
Right, 5 to 7 days. Okay. So when we talk about the sickness itself, what does that actually look like? You mentioned fever and swelling, but are there different ways it presents?
Yes, absolutely. AHS typically shows up in one of four main clinical forms. And how severe it is and which signs are most prominent depends on things like the specific virus strain involved, the species horse, donkey, zebra, and the animal's own immune status. This is where you really see the dramatic impact of the virus. First, there's the pulmonary form. It's sometimes called the paraacute form, or by the Africans named Dunkop, which means thin head.
Dunkop, okay.
This is the absolute worst form. It's incredibly severe and comes on very suddenly. Mortality in horses is devastatingly high, like 95 to 100%,
Almost always fatal then.
almost always. The signs are dramatic. A sudden high fever, we're talking 40, 41 degrees Celsius, that's 104, 106 Fahrenheit. Then severe difficulty breathing. You'll see labored breathing. They have to force air out, flared nostrils, heavy sweating, and often a persistent harsh cough. But the most characteristic and frankly distressing sign is this frothy fluid discharge from the nostrils and mouth. It can be yellowish, sometimes blood-tinged. It's due to severe fluid buildup in the lungs' pulmonary edema.
Oh, that sounds awful.
It is, and it progresses incredibly quickly. Death often occurs within just a few hours, or maybe up to 2 to 4 days.
Hours. Wow. Okay, what's the next form?
The second is the cardiac form. This is also called the subacute edematous form, or DICOT, meaning thick head.
That's thick head, so swelling.
It's exactly. This form is less immediately deadly, maybe around 50% mortality. You still get a fever, maybe 39, 41 Celsius, but the hallmark sign is that edema, the swelling. It's most obvious in the head and neck area. You see swelling above the eyes, in those hollows, the supraorbital fossa, also the eyelids, the face, lips, tongue, and the space under the jaw. It gives the horse that characteristic thick head appearance.
I see.
You might also see congested mucous membranes, maybe with little pinpoint hemorrhages called petechia, and sometimes colic signs. Death, if it occurs, is usually from heart failure, typically within about 4 to 8 days.
Still pretty fast, but slower than the lung form.
Correct. Then there's the third form, the mixed form, which is considered acute. This is actually the one most commonly seen in areas where AHS is endemic. Mortality is around 70%.
Mixed. So a bit of both.
Pretty much. It combines features of the pulmonary and cardiac forms. Often it starts with milder respiratory signs, maybe some coughing, slightly faster breathing, but then the characteristic head and neck swelling develops. So you get a combination of breathing issues and the edema. Death usually happens within 3 to 6 days.
Okay, so that covers the really severe outcomes. Is there a milder version?
Yes, thankfully. The fourth form is African horse sickness fever. This is the mild or subclinical form. It's rarely fatal. You see this most often in the more resistant animals like African donkeys and zebras, or sometimes in horses that have partial immunity, maybe from a previous infection or vaccination.
What does that look like?
The signs are much less dramatic, maybe a low-grade fever that comes and goes, some mild depression or lethargy, perhaps they go off their feet a bit, slightly congested gums, maybe very mild swelling just above the eyes. Often, animals with this form recover completely.
Right. It seems like a huge range of possibilities.
It is. And it makes diagnosis tricky sometimes, because some of these signs, especially the fever or mild respiratory issues, can look like other common horse diseases. Things like equine infectious anemia, equine viral arteritis, even pyroplasmosis.
So quick diagnosis is key.
Absolutely. Early veterinary consultation and proper lab testing are critical.
Oh, and an interesting point about the fever in AHS, unlike many diseases that cause high fevers, horses with AHS often don't lose their appetite, at least initially, which is unusual.
That is unusual. So with this huge range of symptoms, some mimicking other diseases,
Yeah.
how do vets actually confirm it's AHS, especially out in the field?
That's a real challenge. A definitive diagnosis really depends on laboratory tests. You need to actually identify the virus itself. This is usually done using PCR, that's a sensitive molecular test that detects the virus's genetic material, or by trying to grow the virus, called virus isolation, from samples like blood or tissues taken post-mortem, like spleen, lung, or lymph nodes.
So you need samples sent off to a lab. Yes. You can also test blood serum later on to look for antibodies the horse has produced against the virus. And it's really important to stress, certainly in places like the USA where AHS isn't normally found, if a vet even suspects AHS, they have to notify federal animal health authorities immediately. There are specific protocols for sample collection and testing.
Right, it's a notifiable disease. Makes sense.
Imaging can sometimes help too. Chest x-rays or ultrasound might show the fluid buildup in the lungs or around the heart. And if an animal unfortunately dies, a post-mortem examination can reveal very specific signs, like that frothy fluid in the airways we talked about, or the telltale pinpoint hemorrhages.
Okay, so given how serious this can be, how fast it acts, the different forms, what does this all mean for prevention? And is there any treatment if a horse gets sick?
That's the really tough part. There is no specific antiviral treatment for AHS. There's no magic bullet drug that kills the virus.
No cure them.
No cure.
Yeah.
Supportive care, things like keeping the horse comfortable, managing fever, perhaps fluids if needed might help in some milder cases, give the horse a better chance to fight it off itself. But honestly, in most cases, especially the severe forms, supportive care doesn't really change the outcome.
So prevention is everything.
Absolutely everything. The whole approach revolves around prevention and control. It's a multi-pronged strategy, but the main focuses are limiting exposure to the midges, controlling animal movement, and vaccination where appropriate. First, and probably the most critical piece, is vector control. We have to target those Culicoides midges.
The no-see-ums.
Exactly. Since they're most active between dusk and dawn, the single most effective thing is to stable horses during those hours. And not just any stable. Ideally, it should be insect-proof stabling. That means using very fine mesh screens on all openings, windows, doors, things like 80% shade cloth or special fiberglass woven mesh.
So physically keeping the midges out.
Yes. You can even treat the mesh screens with insecticides like pyrethroids for extra protection. Inside the stables, installing fans to create good air movement really helps too. Midges are tiny and not strong flyers, so they avoid drafts.
Okay, fans and screens. What about outside the stable?
Good point. Environmental management is also key. You want to eliminate potential midge breeding sites near stables. That means draining any standing water, fixing leaky pipes or water troughs, and managing manure piles properly, as decomposing organic matter can attract them. And obviously, try to avoid keeping horses near high-risk areas like marshes or paddy fields, if possible.
Makes sense. Minimize their breeding grounds.
And then there are insecticides and repellents applied directly to the horse. There are approved products, sprays, wipes containing things like permethrin or cypermethrin, even some natural repellents like DET, neem oil, or eucalyptus oil might offer some protection, especially on the areas midges prefer to bite, like the head, neck, back, and belly. You can also spray stable walls with residual insecticides.
So a full court press against the midges. Stables, environment, repellents. It sounds like a lot of effort.
It is, but given the consequences of AHS, it's absolutely necessary in areas at risk. Vector control is really the cornerstone of prevention, especially in AHS-free regions trying to keep it out.
Right. You mentioned vaccination earlier, too. How effective are the vaccines? Are they the silver bullet?
Vaccination is another really important tool, especially in endemic areas like South Africa. The most common vaccines available there are live attenuated vaccines.
Live attenuated, meaning weakened virus.
Correct. The virus is modified so it doesn't cause severe disease but still triggers a strong immune response. These vaccines are often polyvalent, meaning they contain multiple serotypes, remember there are 9, to provide broader protection.
That sounds good. Strong immunity.
Yes, the advantage is they generally provide good, strong immunity. But they do have significant drawbacks. Because they are live viruses, even though weakened, there's always a small risk they could cause mild clinical signs themselves, or potentially revert back to a more dangerous form, although that's rare. But the bigger issue, especially for AHS-free countries, is the possibility of vaccine-induced viremia.
Viremia, virus in the blood.
Exactly. A vaccinated horse can have the weakened vaccine virus circulating in its blood for a period. And if a midge bites the horse during that time, the midge could potentially pick up the vaccine virus and spread that.
Ah, so the vaccine itself could indirectly help spread a form of the virus.
Potentially, yes. And it makes it impossible to tell from a blood test whether antibodies are from vaccination or actual infection. That's a major reason why these live attenuated vaccines are generally not licensed or used in countries currently free of AHS like the US or in Europe.
I see. So they're useful where the disease is already common but risky elsewhere. Is research happening on safer vaccines?
Oh, definitely. There's ongoing research to develop safer alternatives, like inactivated vaccines where the virus is killed, or maybe subunit vaccines using just parts of the virus. But for now, the live vaccines are what's mostly available. In endemic areas, strategic vaccination programs are often carried out annually, usually timed before the main midge season starts.
Okay, so vector control is number one. Vaccination is a tool with caveats. What about managing the horses themselves, like moving them around?
That's the third pillar, movement control and biosecurity. This is absolutely crucial, especially during an outbreak or for imports. Any horses being imported from regions where AHS exists must undergo really strict quarantine procedures. We're talking about holding them for at least 60 days, usually in vector-proof facilities, and repeated testing to make sure they're clear of the virus.
60 days, that's a long time.
It is, but it's necessary to cover the incubation period and ensure they aren't bringing the virus in silently. During an actual outbreak in a region, authorities will impose strict controls on moving any horses, mules, or donkeys into, out of, or even within the affected zones to stop the spread.
Locking down movement.
Essentially, yes. And reinforcing that AHS is a notifiable disease. Any suspicion must be reported immediately to veterinary authorities. That allows for a rapid response quarantine, testing, implementing control zones, which is vital for containment.
And basic barn hygiene.
Absolutely. Basic biosecurity helps. Simple things like never reusing needles or syringes between horses, avoiding sharing any blood-contaminated equipment, and disinfecting surfaces or equipment that might have been contaminated are important precautions.
Right. And then just keeping a close eye on your animals.
Yes, that falls under surveillance. Owners in areas that could potentially be at risk should really monitor their horses daily. Check their temperature. Look for any early signs like lethargy, swelling, or breathing changes. And alongside that, authorities often conduct vector surveillance trapping and monitoring the midge populations to understand when and where the risk is highest. It helps predict potential outbreak periods.
It sounds like a multi-layered defense system is needed.
It really is. No single measure is foolproof, so you need the combination. Protect from bites, vaccinate where appropriate and safe, control movement, report suspicions, and keep watching closely.
So let's bring it back to the poor horse. If, despite all these precautions, a horse does get sick, what's the outlook? You said mortality is high.
The prognosis, unfortunately, is generally pretty grim, especially for horses. As we said, mortality can be up to 90%, even higher for that peracute pulmonary form. For mules and donkeys, it might be a bit lower, maybe around 50% for mules. And the disease progresses quickly. Death often occurs within just 4 or 5 days after the fever starts in many cases.
That's incredibly fast and leaves little time for intervention.
Exactly, which again underscores why prevention is so critical. The one piece of slightly better news is for the animals that do survive an infection. They generally develop lifelong immunity.
Yeah, that's good.
But only to the specific serotype they were infected with. Remember, there are 9. So surviving infection with HSV1 doesn't protect them if they get exposed to, say, HSV4 later on.
Ah, okay. So immunity isn't cross-protective across all types. Still complex.
A dual complex.
Right. So just to quickly recap our deep dive here, African horse sickness, AHS, it's a really serious viral disease spread by those tiny Culicoides midges, not horse to horse directly. It hits equids, especially horses, really hard, with different forms ranging from almost nothing to incredibly rapid death, particularly from lung or heart issues.
That's right. And critically, there's no specific cure. Treatment is just supportive. So everything hinges on prevention.
Which involves that intensive vector control stables, screens, repellents, plus careful movement control, biosecurity, and vaccination in some regions, despite the complexities of the current vaccines.
And don't forget the role of those silent reservoirs, like zebras and donkeys, which makes surveillance and control even more challenging.
Absolutely. That was a key takeaway for me.
You know, understanding all this isn't just for people directly involved with horses. It really speaks to the bigger picture of global health, how easily diseases can travel now, and why things like early detection, rapid response, and international cooperation are so incredibly vital.
Yeah, this deep dive into African horse sickness really hammers that home. It shows us something starting in one region, carried by an almost invisible insect, can genuinely pose a significant global threat to animal populations, and maybe even beyond. It's a stark reminder of how valuable knowledge is and how crucial these prevention strategies are for safeguarding, well, our interconnected world. It really makes you think. What stands out to you, Dos, about how such a specific, localized threat can balloon into a global challenge like this?